Breaking news. This is Marco de la Cruz and this is
Eli Sem.
Today we bring you a new storyline coming from Purdue University in West Lafayette, Indiana. A 22-year-old student has contracted leptospirosis infection after swimming in the Wabash River. You may be wondering, what is leptospirosis? So, leptospirosis is an infection caused by the spiral-shaped bacteria Leptospira, and so leptospirosis has many different hosts. So you can have the rodents, raccoons, skunks, and opossums, which you can find in your backyard. And so these guys are not going to be infected very much. As far as like clinical signs, you will not see any clinical signs. However, incidental hosts, which are most of your domestic species, such as dogs, cows, sheep, goats, horses, and cats, these are going to be the incidental hosts, and they will develop clinical signs. And of course, humans, it is a zoonotic disease, so we can get infected as well. How do we get infected? Well, transmission is usually through water contaminated with infected urine. So in this case, the Wabash River would be a good source for it. There is a lot of stagnant water in there. It can also be absorbed by the body, like via the nose, mouth, and the eyes. And if you have open wounds and you go swimming, that can also be a source for it, or even prolonged skin contact. So the clinical signs with Eli.
Thanks, Marco. So the clinical signs, like Marco said, you'll see them in any of your domestic hosts. You'll see them in yourself if you are infected, if you come into contact with any of this infected urine or infected water. So clinical signs for the animals will include anything from fever, decreased appetite, vomiting, increased urination and increased drinking habits, yellowing of the skin and the eyes, and in very serious cases, death. And more chronically, you'll see things develop like kidney disease and liver disease. So if you get it, the most common signs in people include headache, nausea, vomiting, muscle soreness, rash, and death as well. Death obviously comes after chronic signs, which are similar to those that we see in animals, which can include kidney disease and liver disease. Now to everybody's favorite field reporter, Alexei Petrov.
Oh boy, how did you get lepto?
So I usually go Saturday afternoons to swim at the Wabash River, and so this time it was like any other. I was taking a swim. I do a few laps from side to side, and while I was in the middle of one, I actually felt like a little scratch on my right leg, and I was like, that's weird. So I look behind me and there's like a raccoon swimming away from me. I'm like, that's weird. I didn't even know raccoons were near the Wabash River, so that was a weird experience. And then like probably several hours after, I started feeling not like myself. I started having like headaches and stuff. I had to go check on the doctor, and when he was taking like my history and stuff, I told him, I went to the Wabash and I was swimming and a raccoon scratched me. That's kind of how the story came about.
Thank you. Poor boy. I will now tell you how to prevent infection with lepto. For animals, vaccination is very important. Rodent control is also very important, such as keeping food and trash in closed containers and trapping rodents. Avoid contaminated water with your animals. For humans, it is also important to avoid contaminated water and have good rodent control. Wear protective clothing when handling contaminated water or soil. Disinfect surfaces that come into contact with infected animals or infected contaminated soil or water. Cover open wounds when near contaminated water. And also wash your hands thoroughly when handling contaminated soil or water.
Eli is sent back on what you should do if you or your pet comes into contact with contaminated soil or urine that might have lepto. First off, if you suspect that your pet has been contaminated with lepto, the first thing that you should do is call your veterinarian and try to avoid that suspected area where you think there might be a lepto infection. You should also wash your hands and wear gloves when handling your pet. As for you, if you suspect that you've come in contact with lepto, you should continue to wash your hands, stay clean, and seek medical help immediately. If If you need more information on lepto, you can always visit the CDC website at cdc.gov, or you can reach out to one of your local health officials to get more information.